Dr. Wan Rizal.
Mr. Speaker, may I have your permission to answer the next two PQs together, please?
Yes, please.
My response will also cover the matters raised in the question by Dr. Lim Wee Kiak, which are scheduled for a subsequent sitting. Dr. Lim is not here, but I hope he get to read my answer, and if it answers his question, he may want to withdraw his questions for future sitting. We started a Healthier SG pre-enrollment exercise in May this year, so that residents aged 40 and above with chronic care needs can continue to be cared for by their regular GP clinics. So far, over 47,000 of these residents have been pre-enrolled, so the response has been encouraging. We are commencing National Healthier SG enrollment from 5th July this year. We will need to do this in phases to manage the workload of our GP clinics and polyclinics, and ensure that residents have a positive experience when they enroll to Healthier SG. We will prioritize those with chronic conditions, followed by those aged 60 and above. We hope to extend this to residents aged 40 to 59 sometime next year. In providing care to residents with chronic conditions under Healthier SG, family doctors will be guided by care protocols, and we have so far developed 12 such protocols. Every one of them requires significant consultation, coordination, preparation, as well as training. We will expand the coverage and intend to cover mental health in due course. In any case, Healthier SG is not the only avenue to care for residents experiencing mental health issues. Under the Community Mental Health Master Plan, we work with social service agencies to set up community outreach and intervention teams to support persons with mental health needs, as well as their caregivers. This includes educating caregivers on stress management and self-care, linking them with counseling services and support groups when needed, and MOH provides full funding to these teams and residents that can access their services and support at no cost. As Healthier SG is progressively rolled out and stabilized, it is possible for residents to receive annual health reports, as suggested by Dr. Lim Wee Kiak. With Healthier SG, enrolled residents will have access to personalized health plan via their Health Hub mobile app or the web portal. If the resident is diligent with his health screening, he will also have access via Health Hub to his latest health screening results. And we will monitor the usage of this information on Health Hub and explore how we can further enhance it to support residents' health journeys.
Ms. Ng Ling Ling.
Thank you, Deputy Speaker, and I thank Minister for the very positive updates on the number that has already been pre-enrolled. I have two SQ. Some of my Jalan Kayu residents, having heard about Healthier SG, especially the younger ones, who knows that chronic disease risk can start from 40 years old, and seeing that those with chronic disease can be pre-enrolled, asked that in the matter of the year, they understand the phasing and to prioritize our seniors. Should they be in a GP clinic and the GP clinic has the capacity to enroll, can they be more proactive and be allowed? So the question is, if they happen to be in a GP clinic for the next 1 year before the phasing comes, and the GP clinic has the capacity to enroll them, can they be considered? The second SQ is that some of my more senior residents who have been seeing polyclinics for their chronic disease management are quite convinced that GP clinics may be closer to their home as their age, mobility issues come in, being enrolled would be good. So they're asking whether they are out-of-pocket expenditures when they go to a GP clinic for their regular follow-up visits. Will the consultation fee and the medication fee be also managed and be close to what they are paying for polyclinics? Thanks.
First question is about the young. Even with the GP, that particular clinic has capacity nationwide. We do need to look at the nationwide capacity, and we need to prioritize those capacity for those who are older. So from a national perspective, from a systemic perspective, it will be difficult for us to implement this. In any case, Healthier SG is about MOH as well as the health ecosystem doing more to help people take care of their own health. So for young residents, I'll encourage them, with or without the government explicit support, you can always do more to lead a healthier lifestyle. And I think the young are increasingly mindful of that. So please do help us encourage them. There's a lot they can do. Yeah. Eat less sugar, eat less salt, and do less device, have less device time to start with. As for more senior ones, we will encourage private GPs to price their consultations and their services competitively. I do know that because of rising healthcare needs plus healthier SG, costs can increase. But through benchmarking, through persuasion, through encouragement, plus giving more options to patients and residents, we hope there's a competitive dynamics that can keep prices in check as much as possible. So far, healthcare inflation has lagged behind national inflation, and we'll try our best to continue to do so.